What's up, YouTube? It's Station of Euphoria. First, I wanted to say thank you for tuning in. I appreciate your view. I was asked by a subscriber. He asked me about the medical requirements for Navy boot camp and enlisting into the military. All right, so first, when it comes to your medical screening, when you talk to your recruiter, more than likely they're going to ask you these questions. Like, have you been injured? Have you been to the hospital recently? Do you have asthma? Any medical diagnosis? I would recommend, if it's something that you really want, if you haven't gone to the hospital, if it's not documented on TRICARE or anything like that, they're not going to know anything that you don't tell them unless you're on TRICARE, your parent was in the military and you did some stuff using that TRICARE, or if you've gone to like a hospital for it before, if you've ever been like in the emergency room, I would recommend just telling them. But anything other than that, you really just keep your mouth shut, and you can save yourself, So when you arrive at boot camp, well, first of all, you're gonna go to MEPS before you depart. So you're gonna go to MEPS. They're gonna check you out there. They're gonna do their screen, do what they have to do. Then when you arrive at boot camp, maybe your second week, end of your first week, you're gonna go through another physical exam with the corpsman there. They're gonna do blood tests. They're gonna do all this and that. Eye test, vision test, depth perception. They're going to check your teeth. They're going to ask you if you've done tobacco, alcohol, any of that within like the past month, I think. After that, if you have a normal rating, you're done. Now, that's for a normal rating. If you signed up for anything special, air crew, air traffic control, SEALs, air rescue, diver, SEALs, SWCC, any of that stuff, you're going to have another special physical. Now, this is where I got disqualified from the Navy, and this is what I'd recommend for you in the future. If you know you have a heart problem, like if you're a kid, somebody said you had a heart murmur, then you're 10 years old, and they said your heart murmur went away, don't fucking trust that shit. Don't trust that shit, because that's what was told to me. I was told when I was like 5 years old, hey, you have a heart murmur. Then when I was like 10 or 11, they're like, hey, you don't have no heart murmur. And I went to the Navy boot camp, and they're like, hey, you have a fucked up condition with your heart. So, if you've had anything, any doubt, anything like that where you may not be in superior health, you sign up for a normal job. Don't sign up for air crew. Don't sign up for SEALs. Don't sign up for that, because you're going to get disqualified from the military as a whole. You're not going to get just disqualified from those ratings. You're going to get disqualified from the military the whole. That's what happened to me. I can't join the Army, can't join the Air Force. None of that stuff unless I get corrective surgery for my heart. But nonetheless, that's pretty much it when it comes to the physical aspect. But yeah, make smart decisions, score really well on your ASVAB. I don't have any ASVAB training techniques. I wish I could. I've always been a really good natural test taker. I know a lot of people are asking for help on that, but really just study if you have to, and take your ASVAB, choose your rating wisely. Okay, so if you know you have a medical condition, if you ever had asthma, if you ever think, do not sign up for air crew, air traffic control, SEALs, SWCC, diver, any of that. But at the same time, it's good that I found out, because I've met other people where, they were in special forces, had a heart condition, never knew about it, and then they die when they're 37. So, you're kind of rolling the dice on that. You might want to get it checked out. You might want to make sure you're in superior health. But, if it's really your passion and it's really something you want to do now, don't sign up for anything that will require a special physical, which would be what I named before, the SEALs and all that good stuff. But other than that, if you're joining the military, congratulations on you. And, thank you for taking that step, that oath. It's only 1% of people in the nation that try to join the military. So congratulations on that aspect. And if you pass the ASVAB, sign up and get out to boot camp, hey, that's more to you, more power to you. But other than that, that's pretty much the medical screening that I have for you guys. So, I guess that's pretty much it. Thanks for tuning in, and have a nice day.